Hello everyone, my name is Yelda Sarıkaya and today's topic growth and development. Let's start a video about growth and development.
Let's consider the following scenario. 3-year-old Timmy has started making his own breakfast of cereal each morning. Cereal often ends up on the kitchen floor, and he regularly spills the milk when he's pouring it into the bowl. When his mother tries to make cereal for him, Timmy becomes angry and he shouts at her, "No, I can do it." Why is Timmy behaving this way? Has Timmy learned this behavior, or are his actions related to his age, family relationships, or personality? Questions like these are what developmental psychologists try to answer. They seek to understand and explain the behavior that occurs throughout our lives. A number of different theories have been developed in an attempt to explain the various aspects of human growth. Developmental theories provide a set of guiding principles and concepts that describe and explain human development. By better understanding how and why people change and grow, we can help this growth take place in positive ways. One of the most influential theories of human development is psychoanalytic theory. Many modern theories of counseling or psychotherapy are extensions, modifications, or reactions against psychoanalytic theory. Psychoanalytic theory examines the factors that motivate behavior by focusing on the role of the unconscious. Sigmund Freud and Erik Erikson are examples of theorists who support this approach. Freud was a pioneer with his psychoanalytic theory of personality and his psychosexual development theory. Erikson expanded Freud's theories in many ways and developed his own theory of psychosocial development. Psychoanalytic theory's strength lies in its awareness of unconscious motivation and the importance of early experiences on development. Unfortunately, the ideas involved are difficult to test. Because of this, psychoanalytic theory does not have substantial research available to support its ideas. Remember Timmy? Psychoanalytic theory might explain his behavior by saying that he's seeking independence and he's acting in an age-appropriate way for the developmental stage that he is experiencing. As a reaction to the lack of empirical evidence to support the claims of psychoanalytic theory, psychologists became increasingly interested in developing a more scientific approach. In order to do this, some researchers began to study only those things that could be measured and quantified. This led to the emergence of learning theories. Learning theories focus on how behavior is learned. Let's look at some individuals who develop theories that focus on how people learn new behaviors. Ivan Pavlov studied learning through association in his theory of classical conditioning. B.F. Skinner examined the effects of reinforcement and punishment in his theory of operant conditioning. Albert Bandura considered the effects of behavior modeling in his social learning theory. The major strength of behavioral learning theories is their ability to be tested and to be practically applied. The main weakness of these theories is that they generally ignore the effect of the genetic processes and changes that occur throughout the human lifespan. Think back to Timmy's behavior again. Learning theory might explain his actions as a learned response. Timmy knows that if he tries to make his own cereal when his mother's around, she will try to help him. If he acts out when she does this, he gets the attention that he is seeking. His mother's attention reinforces the response, and he learns to repeat the acting out behavior.
Yes. Now we will see the questions about growth and development. There is 15 questions about growth and development. Now, question 1. First question, which age group has the greatest potential to demonstrate regression when they are sick? A. Infant, toddler, adolescent, young adult. The answer is B. Regression is the most seen among toddlers, and it can be caused by stressful situations such as hospitalization, the arrival of new sibling, or starting a new school. When a child regresses, he or she appears to be going backward in an earlier stage of development where he or she feels comfortable. Second question, which is a major concern when providing drug therapy for older adults? Older adults may chew on tablets instead of swallowing them. Older adults have difficulty in swallowing large tablets. Alcohol is used by older adults to cope with the multiple problems of aging. Hepatic clearance is reduced in older adults. Correct answer is D. Age-related change such as a reduction in total liver size and decrease in hepatic blood flow would limit the exposure of drug to metabolizing enzymes, resulting in reduced hepatic clearance of a drug, increasing its side effects. Question 3. Which stage of development is the most unstable and challenging regarding the development of personal identity? Adolescence, toddlerhood, middle childhood, young adulthood. The answer is adolescence. Although it occurs throughout one's lifetime, identity development is considered to be the primary psychological task of adolescence, or as described by Erikson on the identity versus identity confusion. Individuals in this stage start to integrate their values, abilities, inner drives, and past experiences into who they are as persons. Question 4. Which age group will have the most tendency towards eating disorders? Adolescence, toddlerhood, preschool, infancy. Correct answer, adolescence. Adolescence stage is the time where the body starts to change and with factors including exposure from media and peer pressure that provides them the perception of an ideal body image, which would then affect their dietary behaviors, leading to eating disorders. Question 5. A mother of 3 years old tells a clinic nurse that the child is constantly rebelling and having temper tantrums. The nurse most appropriately tells the mother to punish the child every time the child says no to change the behavior. Allow to the behavior because this is normal at this age period. Set limits on the child's behavior. Ignore the child when this behavior occurs. The answer is C. Being consistent and setting limits on the child's behavior are the necessary elements in order for the toddler to learn what is acceptable, so they can understand the impact of their behaviors. Question 6. The parents of a 2-year-old boy arrive at a hospital for a visit. The child is in the playroom when the parents arrive. When the parents enter the playroom, the child doesn't readily approach to the parents. The nurse interprets this behavior as a indicating that the child is withdrawn, the child is self-centered, the child has adjusted to the hospitalized settings. This is a normal pattern. The answer is D. This is a normal pattern. The phases through which young children progress when separated from their parents, including protest, despair, and denial, or detachment in the stage of protest. When the parents return, the child readily goes to them. In the stage of despair, the child may not approach them readily or may cling to the parent. In denial or detachment, when the parents return, the child becomes cheerful, interested in environment and new persons. The mother of a 3-year-old is concerned because her child still is insisting on a bottle at nap time and bedtime. Which of the following is the most appropriate suggestion to the mother? Don't allow the child to have the bottle. Allow the bottle during naps, but not at bedtime. Allow the bottle if it contains juice. Allow the bottle if it contains water. Allow the bottle if it contains water. It is recommended that parents should wean their children off the bottle at 15 and 18 months of age. But if a bottle is still attached to the child at 3 years of age during nap time or bedtime, it should contain only water to prevent the risk of dental caries. A nurse is evaluating of the development level of a 2-year-old. Which of the following does the nurse expect to observe in this child? Uses a fork to eat, uses a cup to drink, uses a knife for cutting food, pours on milk into a cup, uses a cup to drink. By age 2 years, the child can use a cup and can use a spoon correctly, but with some spilling. Question 9. The nurse is providing an educational season to new employees, and the topic is abuse to older clients. The nurse tells the employees that which client is the most characteristic of a victim of abuse. A 90-year-old woman with advanced Parkinson's disease. A 68-year-old man with a newly diagnosed cataracts. A 70-year-old woman with an early diagnosed Lyme's disease. A 74-year-old man with moderate hypertension. The answer is a 90-year-old woman with advanced Parkinson's disease. The typical abuse victim is a woman of advanced age with a few social contacts and at least one physical or mental impairment that limits the ability to perform activities of daily living. In addition, the client usually lives alone or with the abuser and depends on the abuser for care. Question 10. The home care nurse is visiting an older female client whose husband died 6 months ago. Which behavior by the client indicates ineffective coping? Visiting her husband's grave once a month, participating in a senior citizens program, Looking at old snapshots of her family, neglecting her personal grooming. Neglecting her personal grooming, the answer. Coping with mechanisms are behaviors used to decrease stress and anxiety. In response to that, ineffective coping is manifested by an extreme behavior that, in some instances, may be harmful to individual physically or psychologically. Neglecting personal grooming is indicative of behavior that identifies an ineffective coping behavior in the grieving process. A clinic nurse assesses the communication patterns of a 5-month-old infant. The nurse determines the infant is demonstrating the highest level of developmental achievement expected if the infant uses simple words such as mama, uses monosyllabic babbling, links syllables together, coos when comforted. Correct answer is uses monosyllabic babbling. Monosyllabic babbling occurs between 3 and 6 months of age. The infant starts to produce vowels and combines them with consonants, producing syllables. Question 12. A nurse is preparing to care for a 5-year-old who has been placed in traction following a fracture of the femur. The nurse plans care knowing that which of the following is the most appropriate activity for this child. A. Large picture books, a radio, crayons and coloring book, a sports video. Correct answer is crayons and coloring book. In the preschooler, play is simple and imaginative and includes activities such as crayons and coloring books, puppets, felt and magnetic boards, and Play-Doh. Question 13. A 16-year-old is admitted to a hospital for acute appendicitis. An appendectomy is performed. Which of the following nursing interventions is the most appropriate to facilitate normal growth and development? Allow the family to bring the child's favorite computer games. Encourage the parents to the room with the child. Encourage the child to rest and read. Allow the child to participate in activities with other individuals in the same age group when the condition permits. The answer is D. Adolescents often are not sure whether they want their parents with them when they are hospitalized. Because of the importance of the peer group, separation from friends is a source of anxiety. Ideally, the members of the peer group will support their ill friends. Question 14. The nurse is caring for an agitated older client with Alzheimer's disease. Which nursing intervention would most likely calm the client? Playing a radio, turning the lights out, putting an arm around the client's waist, encouraging group participation. As for this C, nursing interventions for the client with Alzheimer's disease who is angry, frustrated, or hostile include decreased environmental stimuli, approaching the client calmly and with assurance, not demanding anything from the client and distracting the client. For the nurse to reach out, touch, hold a hand, Put an arm around the waist or in some way maintain physically contact is important. The last question is the nurse who volunteers at a senior citizens center is planning activities for the members who attend the center. Which activity will best promote health and maintenance for these senior citizens? Gardening every day for an hour a week, 3 times a week for 30 minutes. Lifting twice a week for 60 minutes. Walking 3 to 5 times a week for 30 minutes. The answer is walking 3 to 5 times a week for 30 minutes. Exercise and activity are essential for health promotion and maintenance in older adults and achieve an optimal level of functioning. About half of the physical deterioration of the older client is caused by disease rather than by aging process or disease. One of the best exercises for an older adult is walking, progressing to a 30 minutes session 3 to 5 times each week. Swimming and dancing are also beneficial. Thank you for listening. My presentation is and thank you for your listening. See you next time.